Picture this. A patient undergoes a critical, life-saving vascular surgery. The surgeon comes out and says, it was a total success. Blood flow is restored, everyone's relieved. But what if solving one problem accidentally creates a new one? Today, we're diving into a complication that often goes unnoticed, an unseen risk that can follow even the most successful procedures. So how does that even happen? How can a procedure that's meant to fix you end up causing a whole new set of issues? Well, the answer is hidden in a part of our body that most of us just don't think about. It's a quiet, vital system that, when it gets damaged, can really throw a wrench in the works. And here it is, the lymphatic system. You know, it's not as famous as the heart and blood vessels, but trust me, it's just as crucial. A great way to think about it is as the body's forgotten highway. It's this huge, sprawling network that's constantly draining away excess fluid, moving fats around, and oh yeah, it's a massive part of our immune system. It's basically our body's cleanup crew and security force all rolled into one. So here's the problem. During a vascular surgery, the surgeon is laser-focused on those major arteries and veins. But woven all around them is this incredibly delicate, almost invisible lymphatic network. Because everything is so tightly packed in there, these tiny lymph channels are at a super high risk of getting nicked, cut, or blocked during the operation. And when that damage happens, what's the first thing you see? It's the most common complication of all, post-op swelling, which doctors call oedema. It's the first really obvious sign that our lymphatic highway has a major traffic jam.
So just how common are we talking? Well, the numbers are pretty mind-blowing. In some studies looking at a specific kind of open artery surgery in the leg, up to 100% of patients get this swelling. You heard that right. In some cases, it affects every single patient.
And you know, this really clears up a huge misunderstanding. It's totally natural to see swelling and immediately think, oh no, it's a blood clot, a venous thrombosis. But the research shows that's actually pretty rare. The real culprit, the number one cause, is that lymphatic obstruction we were talking about. The body's drainage system is blocked, and this protein-rich fluid just starts to pool up with nowhere to go. So how can doctors be sure it's the lymphatic system causing the trouble? Well, there are a few classic telltale signs. It usually just hits one leg, not both, and it pops up a couple of days after the surgery. But the dead giveaways are these really specific things, like a kind of hump of swelling on top of the foot, or toes that get so puffy they look squared off. And then there's what's called pitting edema. That's when you press a finger into the swollen area and it actually leaves a little indent for a few seconds. Now, the good news is, managing this kind of swelling is usually pretty straightforward. It's all about good old-fashioned physics, helping that fluid drain by elevating the leg, using special compression wraps, and eventually high compression stockings. What's really interesting, though, is that for this problem, pills like diuretics just don't seem to work. The solution is mechanical, not pharmacological. But a blockage isn't the only thing that can go wrong. Sometimes a damaged lymphatic vessel doesn't just get clogged up, it actually springs a leak. And this leads us to two other potential issues, things called fistulas and lymphoceles. A fistula is pretty much exactly what it sounds like. It's a constant leak. A patient might see this clear or yellowish fluid just weeping from their surgical wound, and it happens most often in the groin area. It's like that lymphatic highway has literally sprung a leak that's now draining to the outside world. And I've got to say, this isn't just a messy inconvenience, it's a real risk. As this quote points out, an open, leaking wound is basically an open door for bacteria. It's not super common, but there's a definite risk of a nasty infection getting down into that wound, which is the last thing you want. Okay, so how on earth do you fix a leak in a vessel that's practically invisible? Well, this is where surgery gets really, really cool. It's like something out of a detective show. First, they inject this special blue dye into the patient's foot. The dye gets picked up by the lymphatic system and flows right up the leg. The surgeon then carefully reopens the incision and literally watches for where the blue-colored fluid is leaking from. Once they spot the source, they can go in and put a tiny stitch right on the leak to seal it up. Absolutely brilliant. Now, what if that fluid leaks, but it doesn't find a way out through the skin? Well, then it can start to collect internally, and it forms a little pocket called a lymphocele. It's basically a contained puddle of lymph fluid that builds up under the skin, forming a lump instead of an external leak. So far, we've mostly been talking about issues in the arms or legs, but things can get much, much more serious when these lymphatic leaks happen deep inside the body, say after a major surgery on the aorta. Now, these are rare, for sure, but the risks are no joke. When these leaks happen internally, there are two main types. If the lymphatic fluid leaks into the abdominal cavity, it's called chylous ascites. If it leaks into the chest cavity, around the lungs, it's a chylothorax. And in both cases, the fluid has this distinct milky look because it's full of fats from our diet. The first line of attack is often to try and stop the leak by changing the diet or simply draining the fluid away.
And just to give you a sense of how serious this can be, one big review of the data found that the mortality rate for chylous ascites after open aortic surgery was 17%. That's a stark reminder that a seemingly small leak in this hidden system can lead to some really devastating consequences.
Okay, so after going through all these potential problems, the most important question has to be, how do we keep them from happening in the first place? And the answer really comes down to one thing above all else: meticulous, careful surgical technique that's all about prevention. And this right here is basically the surgeon's playbook for prevention. It's all about being incredibly careful, using magnification to actually see these tiny, delicate vessels, gently moving lymph nodes out of the way instead of just cutting through them. And if a lymphatic channel absolutely has to be cut, immediately tying it off or clipping it shut. The goal is simple: just respect this delicate network at every single step of the operation. And of course, technology is also a huge game changer. Instead of making a long, open incision down the leg to harvest a vein for a bypass, surgeons can now use these minimally invasive keyhole techniques. And the data is clear: this approach causes way less damage to the lymphatic system and dramatically cuts down on these kinds of complications.
So we end up right back where we started. But now we're looking to the future. We know the problem is accidental damage to this vital unseen network, and we know that careful technique and new technology are the answer. So it leaves us with one last big question. As medicine and surgery get even more precise, what new innovations are on the horizon that will finally make an injury to our body's forgotten highway a thing of the past?